My name is Michael Munro, and this PSYC1011 group presentation is on Diamond et al.'s study on ketamine infusions for treatment-resistant depression. Presentation will be looking at an introduction to ketamine and some background info on this study, as well as the method and results of this study. Then a discussion about these results, followed by a critical evaluation, and then a study proposal that we made to combat limitations of Diamond et al.'s 2014 study. Introduction to ketamine and euphoriants. Euphoriants commonly include drugs such as ketamine, marijuana, and MDMA, and are most commonly used recreationally. However, through new research, emerging benefits for the medical field have been seen as a possible treatment for mental disorders such as depression and anxiety. Ketamine specifically is a dissociative anesthetic and a mild hallucinogen. This anesthetic property being utilized with the veterinary field in the past to sedate horses for surgery. Despite this, hallucinogenic effect has been used recreationally and been utilized as a party drug. Now research is emerging, suggesting that it can successfully treat treatment-resistant depression and provide an alternative treatment for people who struggle with other forms of treatment for depression.
Background to research area. Ketamine is currently used in the treatment of mental disorders as it has been proved to have a rapid antidepressant effect in treatment-resistant depression. A form of ketamine called esketamine is already being used in studies to treat treatment-resistant depression through nasal spray. And because it is a new area of research, the health effects are unknown and must be researched further. However, these are important areas of research because euphoriants can have negative connotations, and new research and studies can continue to reverse the stigma around ketamine. Background of the study. In this study, the beneficial health and cognitive effects of the drug ketamine are studied in order to evaluate its viability and effectiveness in the medical field to combat treatment-resistant depression. Because ketamine has gained lots of traction in recent years for its rapid antidepressant effects, it has been considered as a potential alternative for patients who do not respond to regular or conventional treatments, and it aims to acknowledge the limitations of current antidepressant medications. And finally, ketamine has been researched in combination with current antidepressant medications in order to recognize its effects on treatment-resistant depression and how to further improve its treatment for the future. Outline of the study. This study aimed to test the cognitive and health effects of multiple ketamine infusions simultaneously with other forms of antidepressant medication, as well as evaluating the safety, efficacy, and cognitive effects in a real-world clinical setting. And lastly, its main goal is to present this treatment as a valid and possible alternative to other forms of treatment for depression.
"28 participants with treatment-resistant depression were given either 3 or 6 infusions of ketamine over 3 weeks. 4 to 7 days after their final infusion, post-memory tests were conducted to identify any cognitive effects. Participants were then monitored for 6 months after treatment in order to identify and analyze the severity of depression and side effects to each patient. Results found that 6 low-dose infusions were safe in the treatment of TRD patients, and this is slow in comparison to the response rate found in those taking only single doses of ketamine, where it took longer to develop. There were no significant cognitive effects found in short-term recall, and approximately 70% of patients showed a significant reduction in depressive symptoms and after initial treatments. These analyses indicate that ketamine may be offered to become an alternative to ECT trials completely, for those who are unresponsive to the latter. This also indicates that ketamine-responsive models remain to be a substantial challenge for future research.
So, when conventional treatment fails, the use of euphoriants, particularly ketamine, has promising potential for treating a wide range of mental diseases. Our research highlights the fast start of effect when compared to standard antidepressants, boosting its credibility in mental therapy. Furthermore, no serious health or cognitive side effects were reported when patients continued to take their previous drugs while receiving ketamine treatment. Those who had previously battled with drugs reported positive results, indicating that ketamine could be an effective option for treatment-resistant conditions. These findings add to the evidence supporting ketamine's therapeutic value, despite the fact that some patients did have acute side effects such as anxiety and vasovagal episodes. Addressing concerns about mood swings and suicidal thoughts, particularly after treatment, emphasizes the importance of continued monitoring and more research into optimal treatment durations and supplemental medications. Significant strengths, including a thorough methodology and detailed examination. Participants were carefully chosen using a strict inclusion and exclusion criteria, and the diagnosis were verified via clinical interviews and graded assessments. With this, it guarantees that the sample is relevant and well-defined. The treatment plan was also clear, including ketamine dosage and administration methods to ensure consistency. The Oxfordshire Research Ethics Committee provided informed consent and authorization, ensuring that ethical criteria were met. A variety of assessments, including the BDI and VAS, enabled a comprehensive assessment of mood and side effects, while safety was prioritized through close monitoring of vital signs and adverse effects. Furthermore, individuals were monitored for a further 6 months, providing important longitudinal data. With all of these strengths combined, it provided an effective and thorough strategy to evaluate ketamine's effectiveness in treatment-resistant depression.
This study does have a few weaknesses and limitations that could be improved on in order to increase the validity of this study. Some of these include the administration of the drug. Since the administration is quite intrusive since it's done through infusions, a lot of the participants experienced anxiety, and nasal sprays or pills can be used as an alternative in order to decrease this anxiety. Because so many participants experienced anxiety because of the infusions, 5 out of 28 couldn't complete because of anxiety, and an additional 3 could not complete in general. Some of these are due to side effects, such as racing thoughts, reduced sleep, vomiting, nausea, and some participants actually experienced increased depression and increased suicide ideation. Another limitation is the small sample size. Since the sample size is so small and so many participants could not complete because of anxiety or because of other side effects, it's hard to draw a definitive conclusion about the effects of ketamine. There's also no control group, so there was no testing for the placebo effect in a control group who is told they're receiving the dosage but actually are not, which brings me to my next point, which is that this is an open label study, so participants know what they're receiving and they know what's being tested. So the placebo effect comes into play. Since they know what's supposed to be happening to them, they can think something's happening, but it's actually not. There's also a large variety in the participants, so there's different disorders, different medications that come into play, and so it's hard to draw a definitive conclusion about the effects, and this makes the results very generalized, but then again, it's more applicable to real-life applications.
I want to share our research proposal to tackle treatment-resistant depression. We all know how challenging TRD can be. especially when standard treatments don't work. Inspired by the promising results of short-term ketamine infusions in studies like Diamond et al. 2014, we proposed a long-term study. We plan to enroll 100 patients with TRD and divide them into two groups. One group will receive biweekly ketamine infusions, while the other will get placebo infusions, both over 6 months. Our main goal is to see if these ketamine treatments can sustain their antidepressant effects over a longer period. We will also monitor cognitive functions and the overall quality of life. By extending the treatment period and having a placebo group, we hope to gather solid evidence on how effective and safe ketamine is for long-term use. This could be a game changer for people struggling with severe depression and provide a new option when other treatments have failed.
Ketamine has been proven to be effective in reducing depression in numerous studies, including the one discussed in this presentation. Due to these findings, ketamine has been legalized for treatment of depression in New South Wales in the form S-ketamine via nasal spray. This study used infusions of ketamine to deliver the dosage, which, although safe, can be intrusive for those with anxiety. This study has some limitations, such as the lack of a control group, and is too short in length to see the full extent of the effects of ketamine. Despite these limitations, the study we've presented demonstrates a clear conclusion that ketamine reduces depression and suicidal thoughts.